Hello, welcome to this video for the CF Education Resource Center. My name is Balasa. I am a person living with cystic fibrosis, and I'm 31 years old and live in Richmond, Virginia. Today, I'm going to be talking about the 5 realities of living with advanced lung disease, losing your breath, yet gaining your resilience. The first reality of living with advanced lung disease is that you will have to have more communication and coordination with your care teams. This is overall really important to maintaining and improving your health. So as lung function declines, we have an increase typically of pulmonary exacerbations. They can also become more difficult to treat and somewhat unpredictable. And often symptoms can arise at various moments in life when we least expect it. And although this is a very unfortunate reality, we must be in good communication with our care teams, and they need to be informed about our symptoms because we never know when issues might arise. And so having a clear communication plan, including after hours contact information when we are at home, middle of the night and having a difficult time breathing, having a lot of symptoms, coughing, we need to know who to be able to contact other than just going to the ER. That might be the treatment course of action, but this needs to be clearly defined with our care teams so that it reduces our anxiety for what we do in difficult situations and we need to act quickly. In addition, we probably need more frequent testing, more frequent pulmonary function tests. When we're on antibiotics, we often need to have blood draws for determining the appropriate antibiotic levels, and various other monitorings. So within our clinical care, our maintenance care, this requires additional attention and organization on our parts, and then also our care teams as well. The second reality is that chronic illness can impact our mental health. There can be significant frustration and symptoms of depression even because of the realities that our lungs are failing us. It is really important to not let these thoughts spiral, however, and focus less on the long-term doom of all of the things that we can't accomplish, but more focus on those small everyday accomplishments, whether that is, having been able to cook a meal that day or go to the grocery store and have the energy to do that, or sit outside on the hammock and enjoy reading a book. All of these are small tasks that still bring us fulfillment in our days and can, bring us out a little bit from those feelings of doom and, the difficulty of how we can't do what we wish that we could. And I speak to all of this from personal experience as well. I do live with advanced lung disease, and some days, when I'm feeling an exacerbation coming on, when I am going through an exacerbation, needing antibiotics, it is an accomplishment to do these small things and even just have, relaxation time. In addition, symptoms of anxiety can come from the feeling of breathlessness. When we are unable to breathe, this can bring very spiral really our thoughts and be very scary. And so there can be some psychological interventions to address breathlessness catastrophizing, which can, improve our mental health overall, our quality of life, and our overall treatment plans. This is really important also to talk with those, if we're in a public setting, if we're, we're becoming breathless because we're trying to keep up with, the same walking pace as our peers, or we're trying to walk a flight of stairs and become very short of breath. It's important to be communicative to those around us with our, who we are with, so that they're aware of, what we're feeling inside of our bodies, because it can be very scary and isolating to have these feelings and not have anybody else around us understand and know. The next reality is that fatigue is common, even on our good days. Our bodies living with advanced lung disease have to work so much harder to perform our daily functions just to breathe. We also have to spend a lot of time doing airway clearance treatments, even time resting. All of this takes away from our other responsibilities, even our socializing time. And so we're trying to fit in so much in our days. All of this combined really can lead to a lot of fatigue. And, having our bodies and lungs so limited can also then, of course, weigh on our emotional and mental health, and also leading to even compounded fatigue. And chronic fatigue in CF is believed to be caused by a combination of factors, obviously the respiratory and the symptomatic inflammation of infection, malnutrition as well, and, for, difficulty eating and all of that, not getting enough nutrients and calories, anemia, poor sleep, because it is difficult to breathe when we are, not getting enough oxygen in our bodies and in our lungs. And then, of course, as I said before, the depression and anxiety. And so combating fatigue with daily to-do lists, of course, getting the help of others, our family and friends, is really, really important. Sticking to our treatment routines, making sure that we are keeping our bodies as strong as possible, trying to fit in exercise when we can. Although in the moment, exercising can make us much more tired, in the long run, it can increase our level of endurance and ability so that we are less fatigued as a whole. The fourth reality of living with advanced lung disease is that it does become a visible disability. It's important to accept our condition. Once we have advanced lung disease, others may sense that we have an illness when we are seen using oxygen in public, when we have a coughing fit, or we're having to do our breathing treatments out in public because we have to do them at certain intervals throughout the day, and we may be out and about. And this is difficult to accept. We may be embarrassed. We don't want to be seen as different. I know from personal experience, I have had all of these thoughts in my own head. But over time, I have come to accept, my disease and my condition, and not be as afraid of people's judgment, especially when my disease is visible, when I'm using oxygen in public. When I'm out and about and I have to stop and cough a lot and people are noticing, it's just part of our life. And it's really important to continue, it's important to our mental health to accept it and to do what we have to do in order to stay alive. And so this is, one of the most important realities, really. And lastly, the fifth reality is that transplant can prolong life. When our lungs become so diseased that we can no longer maintain a certain quality of life and it's no longer achievable, that's when it may be time to consider getting a lung transplant. And most CF centers address and bring up the topic of lung transplant once someone has about less than 40% FEV1. And transplant is essentially trading one disease for another. So although our lungs, because they're transplanted, will no longer have CF, we must remain on immune suppression drugs for the rest of our lives so that our bodies don't reject the transplanted organ that we received. And so these medications long-term can cause some other symptoms and other problems down the line with other organs as well. And so we're no longer symptom and disease free. I mean, we still have CF within our pancreas. Most people have to take digestive enzymes for that. That will always remain as well. But, getting a lung transplant is going to allow our lungs to breathe better and have that second chance to experience doing a lot of physical activities that maybe we cannot do now. That is the one thing that I am looking forward to the most, is being able to do a lot of physical endurance activities like skiing, running, wakeboarding, all of these like extreme sports that I have not been able to do for many, many years. And I do, transplant does provide a lot of hope, to look forward to these experiences and opportunities, be able to travel more, be able to breathe deeply, as this photo there shows me staying in front of the Breathe Deeply wall. That's the end of the presentation. Thank you so much for tuning into the 5 realities of living with advanced lung disease.